5-course continuum I've named EntryPoint. And I named it that because I like this concept of knowing when and where to enter the tissue and at what point, and then at what point to enter the bone. And it can be difficult with all of the continuing ed offerings that are out there to know where to enter the implantology game, particularly as a GP. And so this is designed to be your entry point. And if you follow this continuum, you will have placed quite a few implants in a very mentored environment. This will very much increase your chances to being able to place implants on your own when you return. The first course is Surgical Placement Fundamentals. This is a didactic course that will have a lot of hands-on as well. And I think you'll be very pleased with what's covered in this course. By the time you leave that course, you should already be looking for patients within your own patient base that you can start to treatment plan and work up and get ready to treat. That's not to say that you're exactly ready, but you're already thinking that way. Then we have a live patient treatment course that's 2 days, a month later. And in this course, there'll be 2 clinical segments that you'll participate in as doctor. There will be a treatment planning session at the beginning of that. And then at the end of that, there will be a debrief session where you will present the implants that you placed and show that to your colleagues. And it's bookended with those experiences. So we focus on the quality of your experience, making you more likely to be able to go back and fly solo in your own office. My hope is that by the time you get to your 4th live patient treatment course, you're getting to the point where you really are quite comfortable treatment planning these and executing them in your own office. The prosthetic concepts course is in there too, because as everybody knows in our business, what we do has a back end. And so much of continuing education is focused in implants, is focused on the front end delivery of that product. But the back end delivery is what really becomes important as time goes on. The prosthetic concepts course covers that, really starting at the point where tissue is being trained, impressions are taken, components are understood and used at the right time, and the patient is taken all the way through to maintenance there. I think you'll be very pleased with the format of our live patient treatment experiences. I think it's somewhat novel to be able to do this in the United States. There are lots of overseas live patient courses. I just returned from one last night that are wonderful too, but it's not really possible to execute them at this level of quality that we can do at Roseman and with the help of Blue Sky Bio. So I think we've got something here that really scratches the itch of doctors that were like me about, 15 years ago, something like that, when I really wanted to get started with implants, but I just wasn't quite sure where to turn. And I wanted to do them well, and I needed mentorship, and I needed encouragement, and I needed somebody to take me safely through the process so that I could do it predictably and reliably. And that is pretty wonderful when you can find somebody that can take you through that process. So that's what we're about here. These aren't a series of TED Talks, you might say. This is training, and this is designed to train you to get to the point where you can place implants comfortably in your own office. So hope you'll join us.